morning. My name is Layla Muhammad. I'm going to be the PA student that's treating you today. Just letting you know, since I am a student, I will be taking care of you along with my preceptor. So once I'm done speaking with you here, I'll go talk to them and then we'll both come in and see you together. Does that sound good?
Yes.
All right, perfect. So before we begin, could you confirm your first and last name for me and your date of birth?
Samantha Owens, January 1st, 2000.
All right, thank you so much. And how would you like me to address you?
Sam is fine.
Okay, all right, Sam. So what brings you in today?
So I've been experiencing some shortness of breath that started about a week ago.
All right, I'm sorry to hear that. We're going to do what we can to help you today. Just to let you know, we do only have 20 minutes together, so I want to make sure that we cover everything that you're in for. Is there any other concern that you want to address today?
No, it's just that. Thank you.
All right, so starting off, can you tell me more about the shortness of breath?
Well, it just kind of suddenly began about a week ago.
Mm-hmm.
I just woke up feeling like not having enough breath.
Okay.
So
Are you feeling the shortness of breath now?
no, not right now.
Okay. So when you do experience the shortness of breath, where do you feel the discomfort? Like generally what area?
Just kind of like in my chest.
Okay. Anywhere else?
No, just generalized in my chest.
Okay. And then when you do get the symptoms, how long do they usually last?
Well, they come and go. Sometimes it's like a few minutes, and then it can end up being like a few hours in a day. I usually try to go about my day normally.
Okay. Can you describe how it feels when you're experiencing the shortness of breath?
It kind of feels like I can't breathe like deeply enough, especially through my nose,
Mm-hmm.
and I have like tightness in my chest. Sometimes I also wheeze as I breathe in and out.
Okay. All right. When you do have it, have you noticed anything that makes it worse?
Yeah, whenever I lie down or just do things like running or like laugh too hard.
Okay. All right. Any other kind of, so it's just physical exertion basically.
Mm-hmm.
Okay. And anything that makes it better?
Well, I have a history of asthma and I have an inhaler, so that sometimes helps to relieve my symptoms for a little bit. But relaxing, taking calm breaths also helps, but doesn't really like take it away.
Okay. All right. And have you seen anybody or gotten any medical care for this shortness of breath before, or this is your first time?
First time, I haven't had any medical treatment for these before. I experience this often and it usually just goes away by itself, so I'm not sure what causes it or what really like helps it.
Okay. And then on a pain scale from 0 to 10, how would you rate the pain?
I would say like a 3 to 4 after exertion. It causes some discomfort more than pain.
Okay.
So I would describe it more as discomfort, and it kind of impacts like how I'll focus and just like my daily routine, the things I do.
So like daily life kind of just disrupts your focus but not affects you too much.
Yes.
Okay. All right. And you mentioned that this has happened before, right?
Yes.
Okay. How often does it happen?
Kind of just like on rare occasions, I would just wake up feeling like short of breath, or anytime my asthma is triggered, or get a really bad cough, or I just like end up experiencing the shortness of breath.
Okay. All right. So kind of the same as what happened now. You just woke up with it, right?
Yes.
All right. So I'm just going to summarize what you've told me so far. So you've been experiencing shortness of breath for the past week, or it started a week ago, and it's a general discomfort that you're feeling in your chest. It feels like you can't take a deep enough breath. Feels the tightness in your chest. Physical exertion makes it worse, but when you take your inhaler, it helps relieve the symptoms, and like kind of when you relax, it helps it. And you said that this has happened before, and like along like randomly, and also when it's triggered by your asthma. Anything else?
No, you got it all.
Okay. And then so far, is there anything you'd like to ask me?
No, that's just what I wanted to talk about today.
Okay. All right, Sam. So part of my assessment is that I'm going to be taking a more detailed standard questions to get your complete medical history and just to kind of get a full picture of your health. If there's any questions that make you uncomfortable or you don't want to answer, that is perfectly fine. And so feel free to just tell me or just don't answer. Okay. My goal today is to take care of you. All right. All right. So starting off, I'm going to start off with your family history. Do you know of any medical conditions that your family has?
I don't really know much about my dad's side.
Okay, so on like grandparents' side, you're not sure? From your dad's side?
For my dad's side, no. But for my mom's side, my grandpa had lung cancer, and he was like a smoker as well.
Okay, but your grandmother, no?
No, I don't know.
Okay, what about your father?
My father is pretty healthy, no conditions.
Okay, and your mother?
She has migraines.
Okay. any siblings if they have any conditions?
No.
Okay. Do you have or have had any children that have any conditions?
No children.
All right. Are you currently taking any medications other than your inhaler?
I just take my inhaler, just 2 puffs whenever I need it, that's all.
Okay. So albuterol inhaler, you take it 2 puffs orally and just as needed, right?
Mm-hmm.
Okay. Thank you. All right. Any allergies to medications?
Not that I know of.
Food?
No.
Any environmental factors give you an allergy?
Well, sometimes I think I have a dust allergy, and that sometimes triggers my asthma, but just normal allergies, just like sneezing.
All right. Okay. So, can you tell me about any serious illnesses that you've had in the past from when you were a child?
I have had asthma since I was a kid, but that's about it.
Okay. And as an adult, have you been diagnosed or treated for any other condition?
No.
Okay. Do you have regular menstrual cycles?
Yes.
Okay. When was the last period that you've had?
It was about like 2 weeks ago.
Okay. And when did you first get them?
I think I was like around 12 years old.
Okay. And then have you ever been pregnant?
No.
Okay. Have you ever received a mental health related diagnosis or been evaluated for one?
No.
Okay. Have you had any surgeries or blood transfusions before?
No.
Okay. Have you ever been hospitalized?
No.
Sustained any injuries or been in any accidents?
Well, I was like in a minor accident a couple years ago, but I just had some bruises and cuts, like nothing serious.
Okay, well, I'm sorry to hear that. All right. And then, in your own words, how would you describe your overall health right now?
Well, I really wouldn't consider myself pretty healthy, but I'm not unhealthy at the same time.
I see. Can you elaborate?
Well, I try to keep a balanced diet. I do make sure to eat fruits and veggies daily, but I don't really cut back on fried foods. I love my fried chicken and those carbs, so I think I need to work on that.
Okay. All right. When you were a kid, did you get the standard immunizations?
Yes, I did. I can email it to you if you need that.
So you have all your past records, right?
Yes.
Okay. And are you up to date with your tetanus?
Yes.
Okay, thank you. All right, so next I want to know if you've had any screening tests done previously.
No.
Like, have you ever had like a pap smear or a TB screen done?
No, I haven't.
Okay, have you, like in previous doctor visit, have you ever been told that you have like high blood pressure, or have you ever been tested, like your cholesterol level has been tested?
No.
Okay. All right, in your day-to-day at work or at home, are you exposed to anything hazardous?
No.
Okay, so nothing like pesticides, chemicals, smoke, stuff like that, no?
No.
Okay, great. All right, so now I want to ask you to ask about your adherence to normal safety measures in your daily life. So, do you have a smoke alarm in your house?
Yes.
You wear your seatbelt when you drive?
Yep, always.
You use sunscreen every day?
Mhm.
Everything? Okay. Any firearms in your house?
No.
Thank you. Okay, and then exercise-wise, how active are you throughout the week?
I try to like do some walking, maybe like a couple times a week for like 30 minutes, but I'm trying to really work on that because I need to like be more active.
It's good that you have like that self-awareness. Glad to hear that. All right, and what do your meals typically look like throughout the day?
So I love eating breakfast. I like to get my like proteins in, and then I have like lunch. Sometimes it's like rice or pasta with some kind of like chicken, and then dinner. Sometimes I skip dinner, but or do something light.
Okay. What do you usually drink throughout the day? Anything like energy drinks, coffees, anything like that?
I drink tea usually, and water.
Perfect. All right. Wake up in the morning. Can you describe your daily routine for me?
So I wake up like I think around 8, and then I go commute to work for about after I eat my breakfast and get ready. I commute to work for about 10 minutes. I'll be there from like 9 to 6, sometimes longer. Then I'll just go home and relax with the day and just do whatever I feel like.
Okay. And how much sleep do you typically get in a day?
I would say like 7 to 8 hours. On the weekends, maybe more.
Okay. All right, Sam. So I also routinely ask my patients about their alcohol, tobacco, or recreational drug use. So have you ever smoked before?
No.
So no tobacco products, no vaping,
No.
nothing like that? Okay. Do you drink alcohol?
No.
Have you ever drank alcohol?
No, never.
All right. Any recreational drug use?
No.
Marijuana, anything like that?
Mm-hmm.
Okay, thank you. And you mentioned that you go to work. What kind of work do you do?
I actually work at a family care clinic as an MA.
Okay, nice. And are you also a student while you're working?
Well, I already graduated with my bachelor's a few years ago.
Okay, congratulations.
Thank you.
All right, so next I wanted to ask about your spiritual or religious aspects in your life. Is your faith or belief important to you in your daily life?
Yes, definitely.
Okay. Do your beliefs hold any restrictions on your health? So are there any specific beliefs, practices, or restrictions that I should account for in your care plan?
Nothing really impacts like my health in any way.
Okay. All right. Thank you for letting me know. All right. Are you feeling any level of stress from anything in your life right now?
Not really.
Okay, that's good to hear. Are you currently living alone? Do you live with your parents?
I live with my parents in their house.
Thank you. All right. Are you currently in a relationship?
No.
Okay, thank you. All right, so next I'm going to be asking about your sexual history. So we ask these questions to make sure that we provide the most relevant care to you. And everything that you share with me is going to be completely confidential. And again, if there's anything you don't want to answer, feel free to do so. That's perfectly okay, all right?
Okay.
All right, so what sex were you assigned with at birth?
Female.
Okay, and how would you currently describe your identity?
Female.
Okay. And you go by she, her?
Yes.
Thank you. Are you currently sexually active, or have you ever been sexually active?
No. Never.
Thank you. And how do you identify your sexual orientation?
I'd rather not say.
Okay, that's fine. Thank you. Thank you for letting me know. All right. So, since sexual health is so important, do you want to talk about keeping yourself safe when or if you decide to become sexually active?
Not today.
Okay, that's perfectly fine. And then thinking about the future, do you see yourself having children or starting a family?
No, anytime soon.
Okay. And then for later, do you want to talk about contraception or pregnancy prevention during your visit today?
No, not today.
Okay, thank you. All right, so we're just gonna go back to questions regarding your health wise. So I wanted to ask you some general questions about your health to make sure that we haven't missed anything else today. Have you noticed any fevers recently?
No.
Fatigue?
No.
Any unexplained weight changes?
No.
Okay, thank you. Any rashes?
No.
Dry skin?
No.
Any color changes in your skin?
Not at all.
Okay. Do you wear contact lenses?
Yes, I do.
Okay. All right. How long have you been wearing them?
About like 4 years.
Okay. And then with them on, have you noticed a change in your vision?
No.
Blurry vision?
No.
Any eye pain?
No.
Redness?
No.
Anything like that? Okay. All right. Are you having any problems related to your ears today?
No.
So any tenderness?
No.
Vertigo?
Mm-mm.
Ear pain?
No.
All good. All right. Perfect. Have there been any changes to your sense of smell?
No.
Any sinus pain?
No.
Congestion?
No.
All right. Good to hear. Any tooth pain?
No.
Sore throats?
No.
Any jaw pain?
No.
Okay. Perfect. Are you experiencing any neck pain?
No.
Any stiffness?
No.
Any change in your range of motion?
Not really.
Okay. Good. Thank you. All right. And then connecting with your shortness of breath. When you do get it, or even before that, are you experiencing any coughing?
Yeah, I do. I mean, not actually coughing, but I do have like some wheezing whenever I try to like take a deep breath, and it does hurt when I do that, and I feel like my chest tightens up when I try to breathe in deeply.
Okay. So wheezing, yes, with the shortness of breath, and then pain with deep breaths, right?
Yes.
All right. And you mentioned waking up with shortness of breath sometimes, and you said that lying down or exerting yourself while you're experiencing it makes it worse, right?
Yeah, just
Any chest pain?
just the tightness that I mentioned earlier.
Okay. Any palpitations? So does your heart race?
Not really, no.
Okay. Any swelling?
No.
Have you ever fainted?
No.
Okay. Thank you. Now, are you experiencing any claudication? So any muscle pain, cramping, or weakness?
No.
Okay. Have you noticed any changing in the color of your skin around your legs, feet, or toes?
No.
Okay. Any swelling in legs, ankles, or feet?
No.
Okay. Perfect. Have you had any change in your appetite lately?
Maybe just like I feel like I have a low appetite nowadays. Yeah.
Okay. Any heartburn?
No.
Nausea?
No.
Any abdominal pain?
No.
Okay, thank you. Alright. Do you experience any pain, burning, or difficulty when you urinate?
No.
Okay. Any blood in your urine?
No.
Any back or any flank pain?
No.
Okay, perfect. Alright. And have you noticed any tenderness in your breasts?
No.
Okay. Any masses or anything that you felt? Okay.
No.
Any nipple discharge?
No.
And then you mentioned that you have irregular periods. Are you experiencing any like severe cramps when you have them?
Not really. I mean, nothing that Tylenol or Advil can't fix.
Okay. And then any vaginal discharge outside of that?
No.
Any itching?
No.
Okay, perfect. Do you get any muscle aches?
Not really.
Any back pain?
No.
Okay. Any like feeling weak, especially in your muscles or anything like that?
No.
All right. Have you been feeling restless at all lately?
Sometimes whenever having dealing with this chest tightness.
But outside of that?
No.
Any nervousness?
No.
Okay. Have you noticed any changes in your mood?
No.
Have you noticed that you easily bruise?
No.
Whenever you get like a tiny cut or anything like that, is it kind of hard to get the bleeding to stop?
Not really. It's normal.
Normal? Okay. Have you noticed any swelling or lumps under your jaw, in your armpits, or in your groin area?
No.
Okay. Have you had any changes in your speech?
No.
Any headaches?
Mm-mm.
Dizziness?
No.
Any tremors or spasms?
No.
Okay. Thank you. And then have you felt any excessive hunger or thirst?
No.
Okay. Any excessive sweating?
No.
Hair loss?
No.
Okay. All right. Well, thank you so much, Sam. It's really been a pleasure getting to know you more. That's all the questions that we have for today before we move on, okay?
Okay.
Do you have any questions for me?
No, that's all.
All
Thank
right.
you.
Thank you.